It is my pleasure to welcome all to the research collaboration signing ceremony today between the National University Health System and Visual Engineering. So this day is much awaited due to the delay caused by the coronavirus outbreak. There is also much to celebrate as I understand this is the first partnership between NUHS and a Norwegian company. So congratulations to NUHS and Visual Engineering and wishing you a successful partnership. So without further ado, let's start with the video from CIH and VE, Visual Engineering.
Are you close to ready for haircut yet, Sammy?
No, I'll let you know.
Okay.
Okay, up again.
Welcome to the Center for Innovation in Healthcare. As we walk along this corridor, we are reminded of how healthcare services started and developed as a hospital-centric way of delivering care and medical treatment. The Center for Innovation in Healthcare is here to transform the healthcare system into a patient-centric one and allows for the delivery of care beyond the walls of the hospital. As we move into the showroom, we make way for a new era of advancements in healthcare technology. The technologies we adopt will improve various parts of the patient's journey, which are the different stages of health a person can experience. It starts off with a healthy individual. In this zone, user-friendly devices and wearable sensors enable them to monitor their general health and wellness. The next zone is where individuals are feeling unwell but are not yet sick. Here, the focus is on health tech solutions that provide early detection and quick diagnosis capabilities for common chronic conditions such as heart disease, diabetes, and stroke. This allows for better preventive care as well as efficient and timely triaging of patients with clinically significant conditions to the hospital for necessary intervention. Unfortunately, along the way, people fall ill and need to be hospitalized. This zone focuses on improving the quality of patient experiences in the hospital, using cutting-edge technologies to provide seamless and integrated patient care, or freeing up hospital resources. The last zone focuses on post-discharge care, where assistive rehabilitative technologies and robotics help to optimize patients' recovery and independence. At CIH, we believe in the importance of education and the power of knowledge. We organize events to give you first-hand insights from healthcare leaders and enable access to a pipeline of the latest health and medtech breakthroughs. Hosted by CIH, the Health Horizons is an exclusive community of influential individuals and organizations from the thriving innovation ecosystem in Singapore. We share a mission to accelerate effective new health innovations from idea to global impact and public good. Mingle with the community at our cozy coffee lounge, where conversations begin, friendships are forged, and ideas are born. Join our community of co-innovation partners at Hello CIH, an open and collaborative workspace for the medical and health technology ecosystem. Leave your mark here at an exclusive hub nested in a public hospital, a dynamic ecosystem of healthcare innovators, clinical users, health tech, and medtech startups.
I'd like to invite Her Excellency Anita Negro to give the opening remarks. Anita, to you, please.
Thank you, Susanna, and it is a real pleasure for me to be here today and to see this collaboration really kick off, and a great example actually of the relationship now between Norway and Singapore. So Norway and Singapore go way back until back in time, to before any of our countries were independent nation states in the modern sense. So from the 1850s, Norwegians were part of this region, and I think we've seen how both countries have developed, and how we are both now very advanced and open economies. In fact, we're both in many ways dependent on the 3 T's, talent, technology, and trade. And from being primarily perhaps ocean partners in the earlier days, we are really now becoming innovation partners. We had a great example of this, showcasing many say avenues and cooperation within several industries only last week during the Singapore-Norway Innovation Conference, where we had political level participation as well from both countries. There are a number of cooperation agreements, MOUs, between both our research councils or a National Research Foundation, our universities and research institutions, as well as specific arms of the government. And lately, last week, also between Innovation Norway and Enterprise Singapore. So we do have a very solid basis for taking this further. We see many joint opportunities within maritime technology, smart cities and sustainable solutions, as well as health tech and meditech. In many ways, I think for both countries, the mantra really is that competitiveness will be driven by innovation in our next phase of development. So also on this basis, it's a great pleasure to be part of this signing ceremony of the research collaboration today between visual engineering and the Center for Innovation in Healthcare. It's an example of the new and forward-looking collaboration between our countries, but also perhaps of how existing skills and technologies may be made new use of in new industries, new sectors. So with this, congratulations to you all, and I wish you well with the research collaboration going forward. Thank you.
Thank you, Anita. Our next speaker is Paul Kassmann, Director of Innovationary in Singapore. Paul, to you.
Thank you so much, Susanna. Thank you so much, Anita, Professor Yo, Ula, Angie, Professor Ho, and Hung Long. Very good to meet you all again. First of all, let me express my great excitement with this joint research project now established between visual engineering and the Center for Innovation in Healthcare of the NUHS. As Susanna said, it's the first collaboration of its kind between NUHS and a Norwegian health tech company, and I venture that this will pave the way for more collaboration in the future. And why does this make sense? Well, the healthcare system in Singapore is presently going through a rapid transformation to meet growing demands in the population. And there are several reasons for this, and they are quite familiar. because like Norway, Singapore has an aging population and a rising prevalence of chronic diseases and poor lifestyle habits. All in all, this translates into rising healthcare costs and diminishing tax returns. And finally, there is a crunch on the availability of healthcare workers, which just sort of exacerbates this situation. And this means that we have to focus our attention on prevention, promoting a healthy lifestyle and becoming better at identifying risk factors. It means that we need to have a holistic life cycle approach to healthcare, where home hospitalization is a viable alternative. And finally, we need to improve the quality of care, ensuring the right treatment and making manpower more qualified and more efficient through innovation. And this is where visual engineering comes into the picture with their gaming technology, which is enabling the training of complex operations in a safe virtual environment. And leveraging on the research strength at the NUHS, we believe this project will produce exciting results for the future of skills training. Now, Innovation Norway is the Norwegian government's agency for innovation and internationalization, and we support startup companies and innovative business clusters. Our cluster program finances several health tech clusters in Norway, and we work closely with them to match Norwegian solution providers with possible partners abroad. Just last month, we organized a virtual health tech program stretching over 2 weeks, where 18 Nordic health tech companies met with Singaporean stakeholders, including the CIH and NUHS. And in May, we organized a virtual workshop with healthcare clusters in Singapore exploring COVID-19 relevant technologies. And as I said initially, we face some of the same challenges within healthcare in Norway and Singapore. And that's why it makes sense to collaborate on finding good solutions. There are several collaboration projects under development at the moment, and we're looking forward to supporting these initiatives going forward. And we wish, of course, Visual Engineering and CIH and UHS the best of luck. Bon chance.
Tusen tak, Paul. Next, I'd like to invite Dr. Lawrence Ho, who is the director of the Center for Innovation in Healthcare. Over to you, Dr. Ho.
Thanks, Susanna. So I'd like to first start off by thanking Anita for gracing this occasion, which is something that we are very pleased about. And also I'd like to thank Kassmann and for the support I think he has given us over the years. And this very nice space. And also I think the support to try to build up a center for innovation, which I think is one of the best in Singapore. And again, thanks Jason for this really unfailing support locally for us to do anything we like, essentially. So I think in working with visual engineering, we certainly enjoy the technical part, because personally I believe virtual reality is something which has to come one way or another in the near future. Okay, so with I think people talk about artificial intelligence, which is already here, and then robot is slowly making its way. And I do believe that I think the virtual reality will come. There's no question about that, because I think after we sort of come in with the brain, artificial brain, then we come in with the artificial limbs, but we miss the emotional part. That's where we are trying really hard to create this emotion. I spoke a lot when we are working with the VE team. We have to get this emotion come up, otherwise we fail. So without this immersion, without all these things, we are not going to succeed. So I think now we are trying to kind of learn and also co-create values together. Obviously, I think you have the technical strength. You also have the commercial expertise, which is very important for us. And on the other hand, I think we do have doctors, I think, who can provide the very useful user experience. So I think together, I believe that this sort of collaboration will leapfrog us ahead of, I think, the learning curves, as well as the harms going through so-called innovation to adoption I think, the entire ecosystem and the cycle. So hopefully, I think together, I think we can work hard and create this as a use case. And then if we are successful, I believe that we can certainly, I think, use this particular use case to springboard to many more use cases in future. So this is what our aspiration is. Again, I thank you all for this opportunity to be able to work with this fantastic team. Thank you.
Thank you, Dr. Ho. And our final speaker for today is none other than Ola Olsen, the founder and director of Visual Engineering.
Thank you, Susanna, and thank you, Lawrence. Thank you, everybody. VR is actually not a very new technology, but it's a quite exciting time we are in now, because now the hardware has come to a level where it's actually mass adoption can happen. And it is not the gaming industry that is adopting it, it's actually industry. So practicing and training. So VR is a fully enclosed digital environment that replaces the real environment, and it gives an opportunity to train on something that is otherwise would be impossible. And the market forecast for spending on VR for training is expected to reach $2.2 billion in 2022. And also during COVID-19, the pandemic ongoing, we see that it actually reinforces its value because you can train people remotely and you can communicate remotely. Today, most healthcare VR training simulators in the market are tools for teaching of knowledge or procedures. Most of such tools do not focus on the non-clinical skills such as communication, teamwork, and decision-making under pressure. With the support now from Innovationary and the team at National University Hospital Singapore and in Tang Phong General Hospital, Visual Engineering is now developing and testing a new VR training simulator that uses non-linear concept, wireless hardware, and other cutting-edge technologies that allow doctors to communicate, make decisions, and practice the trauma care procedure as a team. And that is without the restriction of handheld controller and user interface. So you are replicating the real world actions. And working across Norway and Singapore with a talented and dedicated team, the progress we are making now every day is most exciting. And we are 50% into the development work. And I'm looking forward to sharing with you the completed solution in the coming months. So thank you very much, everybody.
Thank you, Ola. Thank you to all our speakers, and we shall take a group photo before we wrap up this event. Daphne, can you kindly promise when you're ready to take the screenshot? And we need to have a thumbs up, all right? So please thumbs up for the Photoshop.
Okay, ready. I'm going to take 1, 2, 3.